Welcome to Focus on Health, a series of educational programs highlighting current health issues sponsored by the Department of Nursing at Salisbury University. I'm Dr. Mary DiBartolo, Professor of Nursing at Salisbury University and host of the program. I welcome back a frequent guest in Dr. Elizabeth Burke from Peninsula Dermatology. You are also on the staff at Johns Hopkins University School of Medicine, Department of Dermatology. And every summer or two, we like to get together and talk about updates in terms of skin cancer and sun safety products. So that's what we'll discuss today, sunscreens and sun safety. I believe one of the first things you want to do is give us an update on where we are in terms of skin cancer.
Thanks for having me back, Mary. There is still a rise in the number of skin cancers in the United States. And there are more melanomas, about 50% more the number of melanomas than there were in the 1980s. And part of that is due to tanning bed use. But the other part of it is the fact that people are living long enough to actually get their skin cancers. The same thing is true of basal cells and squamous cell carcinomas, which are those are the three most common kind of skin cancer: melanoma, basal cell, and squamous cell carcinoma. And as people are living into their 80s, we're seeing a large increase in the number of those skin cancers. Back in the 1930s and 40s, it actually was not popular to tan. It really started to become popular to tan after World War II. People were seeing the troops come home with these great tans from the South Pacific, and women started wearing less on the beach and going to the beach more often, and it sort of became a way of life for Americans. Before that, people did not seek a tan. The only people who actually tanned were people who worked outside, farmers and fishermen, and people who were forced to be outside. So not only are people living longer, but they're choosing or did choose to be out in the sun for longer periods of time. So this is why we're seeing a rise in the number of skin cancers overall.
Well, that's interesting because I know we talk a lot about the aging population and we think about chronic illnesses and not so much skin cancer. So that's interesting.
Yeah, and for a lot of older folks who are in their 80s, skin cancer is a chronic disease for those people because they've accumulated so much damage over the course of a lifetime that for many of those people, we see them on a very regular basis, some as frequently as once a month. So it is important to try to do something to diminish or to decrease the numbers of skin cancers moving forward.
So it is like a pot that you fill over time, and it starts when you're very young as far as your exposure mounting up.
Correct. And that's something that most people don't understand. People will come to me when they're 40 and they don't have any problems with their skin and they're tanned, and I will tell them this is not a good idea because the sun damage does add up over the course of a lifetime. And it's not until people actually start to get skin cancers, oftentimes, do they realize that they've sort of reached their body's threshold, and then they just keep happening. So from a long-term perspective, starting at a very young age, it's actually a good idea to not seek a tan. The American Academy of Dermatology has recommendations regarding sun safety. They do recommend that people avoid the midday sun between 10 and 2. And if you have to be out there, sunscreen alone is not sufficient. Sunscreens were designed to prevent you from sunburning, but you're still accumulating sun damage even if you're getting a tan. So we do suggest that you wear hats, that you wear photoprotective clothing if you're going to be out in the middle of the day. And we also suggest that you avoid the beach, especially with very young children. We don't think it's a good idea to take your babies to the beach.
Well, they say you shouldn't put sunscreen on babies till at least they're 6 months. So I think mothers find themselves in a dilemma with that.
Correct. But really the whole idea is just don't take them to the beach. And if you are going to take them, they need to be covered up. So you want clothing on them and you want to have them in a little tent so that they're not getting a tan. Technically, you actually can use some of the sunscreens, especially the zinc-containing sunscreens that are out there for babies. And those are actually can be used in very young children. but optimally you don't want to expose them to the sun at all.
And I know one of the reasons we wanted to do this show is there's been some recent research about the products out there that are sunscreens and how confusing they can be, and that most people are using them or not using them, and the ones that are using them don't really understand what the label is saying, and starting with SPF, which is a sun protection factor. So I know you wanted to go through some of the terms that you see on the labels and discuss the ingredients and what they mean.
Well, I'm sure a lot of people have noticed, especially the folks that do use sunscreens, that there's been a shift in labeling on sunscreen bottles. And that actually was in response to a request on the part of the FDA to change how sunscreen bottles were labeled back in 2011. They don't want sunscreen labels to say that they are waterproof. They don't want them to say that you can prevent skin cancer with them. And they also are not convinced that there really is much added benefit to a sunscreen that has an SPF greater than 50. When you look at the charts in terms of the amount of photoprotection that you get from a sunscreen, it kind of levels off after about a 50. So as you're going up on the SPF, it is providing more protection up to about a 50, but then what you gain after that is really rather minuscule, and it's not something that can be easily quantitated, so it's debatable whether those higher SPFs are really that much more photoprotective. When you do wear your sunscreen, it is important to wear it every single day. There was also a study that just came out in 2013. The CDC was gathering data and wanted to see, do people actually wear sunscreen? Only about 14% of men and 29% of women routinely wear sunscreen. And those are pretty low numbers when you think about the efficacy of sunscreens. So there's been a big push on the part of the American Academy of Dermatology since then to get people educated about the importance of wearing sunscreens on a daily basis. For some people, when I say put your sunscreen on every day, they're like, well, I don't go out in the sun that much. Our definition and the individual patient's definition of being out in the sun are two entirely different things. If you are driving to the grocery store in the middle of the winter in a car, you're still getting sunshine. In addition, we were talking about how there's that much more sun or that many more skin cancers. The other thing that adds to that is the fact that a lot of people are now on multiple different medications for their other medical problems. So they're on things like diabetes meds, cholesterol, high blood pressure medications. Virtually every single one of those makes you more sensitive to the sun. And it's not something that you're going to notice again, but it's something that's just going to add to that bank of sun damage. And that's why we want the sunscreen on all the time, even on a cloudy day.
Because of that windshield effect too?
Well, what happens, this is when they asked the sunscreen manufacturers to change the labeling, they wanted them to be labeled as broad spectrum. And the reason is they want people to use something that covers both UVB and UVA. And UVB is the traditional wavelength of light that the older sunscreens use to protect against. But the UVA band of light is what makes it through the windshield even on a cloudy day in the middle of the winter. That's also the wavelength of light that most medicines make you sensitive to. So again, it's not something that you're going to really notice that much. But when you think about living a long time and continuing to add to the bank of damage, your sunscreen really is your best friend in terms of protection. We don't want you to stop the medications. We don't want people to live in a box. We want people to be out and be healthy and be exercising. So it's important to add in addition to your sunscreen, make sure you're wearing hats. Make sure when you have a choice between wearing long sleeves and short sleeves, especially if you're going to be out for a prolonged period of time, to wear something that is long sleeved.
Now let's get back to the SPF for a minute. Because that is still confusing the most, and I know we were chatting before the show saying that if people would wear at least a 30, even though
Correct.
efficacy drops off at 50, but 30 is what I think most people feel is fairly protective. What does that mean exactly, an SPF of 30?
Well, it's a sun protection factor. And for most people with an average amount of sun exposure, you are cutting down on the percentage of both UVA and UVB rays that you are absorbing in the skin with an SPF of 30. And that's now what the American Academy of Dermatology recommends that everybody wear every day, is an SPF 30, and make sure that it's, quote, broad spectrum. What broad spectrum means is that it covers UVB and UVA. So when you're looking for your sunscreen, even if it says broad spectrum, a good idea is to flip the bottle over and read the back. Things that provide UVA protection are things like zinc, titanium, avobenzone, and oxybenzone.
The thing is, there's so many other ingredients you see on that label. It can be so
Right.
confusing. And a lot of it's marketing strategy, you know, calling things by fancy names, put them on the front of the label. We have this kind of component in here. It is very confusing for the consumer.
Exactly. And so the main thing, like I said, the main thing is just to make sure it's an SPF 30 and that it has one of those active ingredients in it. The ingredient that I like the most in sunscreens is zinc, because it provides the broadest spectrum of coverage for what we know of. And of all the other agents that are available that provide broad spectrum coverage, zinc is the product that will not irritate the skin. For a lot of people, avobenzone, for instance, can be somewhat irritating to the skin, and it also can turn your clothing yellow. So zinc is pure. It stays with you, it stays on the skin, and it really provides a good barrier.
And it doesn't burn the eyes either. I know I can find that annoying. There's certain ones I put on, if they get in my eye, it's
Well, all of the
problem.
sunscreens are going to have some preservatives in them. They have to. But again, some of the ones with the highest zinc content really have the fewest things added to them. And they're also, a lot of sunscreens smell real good. You know, they want you to feel like you're, you know, in the
Smell like a
Caribbean.
coconut or
Smell like a
something,
coconut.
yeah.
And that's actually a lot of times what irritates the skin.
the
So
fragrance.
especially, exactly. So if you have very sensitive skin, the baby formulas don't have any fragrance in them for that reason. And those are the ones that you should really look at. And you don't have to spend a lot of money. Coppertone makes great products. Even NOAD, which is a generic, will make good products. And there was just recently a report in Consumer Report where they talked about the efficacy of different sunscreens, and they tested to see if what they reported was accurate. And Coppertone's SPF 50 came up as one of their top 2 products. So again, when you look at it price-wise, if you want to check the Consumer Report, it's right there. It's a very reasonably priced item without overspending. But there are more than one Coppertone SPF 50. You want to make sure you get the one that has zinc. So again, flip the bottle over and read the ingredient list, and the first ingredient on the list should be zinc.
And these are called sunscreens. They're not allowed to call themselves sunblocks anymore.
Correct. They're called sunscreens.
How long is a bottle of sunscreen good for?
It depends on what the active ingredients are that are in it, but all of them actually have an expiration date on them. Most of them are probably good for about a year at most.
I know a lot of people just throw stuff in their beach bag and then just continue to use it the next summer. Probably not a good idea.
Probably not a good idea. You
Get the-
will find the expiration stamped. If it's in a tube, it's usually stamped where the tube, not on the end where the cap is, but on the opposite end. And you just look around, you'll find it on the bottle.
And still good advice to apply about 20 minutes or so before you're actually going to be out in the sun so it can be absorbed.
Absolutely. 15 to 20 minutes before you even step outside the door. And regardless of what your SPF is, whether it's a 30 or a 50 that you're using, they are still to be reapplied every 2 hours. Having an SPF 50 doesn't give you a longer span of coverage. It gives you a better coverage, but it's for the same period of time. So what's recommended is if you are going to be out and let's say you are doing a lot of physical work and you're perspiring, you should definitely be reapplying every couple of hours. If you're at the beach and you go into the water, when you come out, you should reapply. Because again, sunscreens are not waterproof, they're really just water resistant. So
And they're not sweat proof either, I take
correct,
it. Yeah.
correct. And you really want to apply them rather thickly. People under apply their sunscreen. So you should use at least an ounce of sunblock per limb and for the trunk, and probably a half an ounce for the face. So I always find it kind of humorous when people tell me, oh yeah, I had the same tube of sunscreen from last summer and I was at the beach all the time. That one tube is
They mustn't
really
be putting on
not
very much.
No, it's not. I think they might do a little on the nose, but it's not going to last for the summer. I mean, you really have to be generous with the sunscreen. And probably the best thing for parents to do, and I always tell them, is before you even go to the beach, you know, strip the kid down, make sure that you are covering every part of their body, even the stuff that's underneath the bathing suit, because the bathing suits aren't 100% photoprotective either. And then when you get to the beach, while you're driving there, they will have had time to absorb the material onto their skin. Sometimes the parents ask me about the sprays. Now,
I was just going to ask that.
Yeah, the sprays we're not big fans of because the sprays require that you apply it really very diligently, like you have to be close to the skin. And really, if you want to make sure that you have adequate coverage with them, after you spray it on, you still need to rub it in. And that's one of the reasons folks like those for the beach, because they've got sand on them and they don't want to be rubbing anything in. Well, if you're just kind of spraying it around in the air, you're not actually getting any on the skin and it's not very protective. They also have been some reports of children having exacerbation of their asthma from getting the spray in the airway. So I'm not sure how much validity there is to that, but even a lot of the spray manufacturers have been backing off for that reason.
Now, Liz, it seems like the FDA is getting more involved and protective about these kind of issues with the upper number SPFs. You know, no more than 50 is pretty much not any more effective than a 50. 30 is what we're saying. Try to use at least a 30. What about the lower SPFs that you see? Because you still see a lot of 15, 8s. I even see 4s. I see oils that say they're 4. And I imagine the oils can't be any good at all. They seem to attract the sun. So.
Right. And they aren't. Those products really aren't going to provide you with any kind of sufficient cover. You're going to see a lot of regular skincare products that have the 15 in them. That's a common number that you're going to see in daily moisturizers. And that's helpful, okay, for a daily moisturizer. But that's still not the minimum recommendation. The minimum recommendation on a daily basis is an SPF 30, and with a physical blocker of some variety. Okay,
that would be your zinc, your titanium.
Your zinc, titanium, some broad spectrum coverage. What you are going to find is that over time, a lot of the lower numbers are probably going to be no longer produced. So, for instance, there are certain sunscreen manufacturers now that have only an SPF in their daily facial moisturizers. When we go to the counter to buy them the next time, you're going to see that the numbers are going to be going up. So for a long time, everything you saw had a 15, and I think what you're going to see in the next couple of years, because of these regulatory changes, that you're going to see things having a 30 in them.
Instead of a 15.
Instead of a 15. And I wouldn't, you know, recommend using a 4 or a 15. I mean, if you want to be serious about your sunscreen use, shoot for the 30 with broad spectrum coverage.
What about tanning beds? Where are we in getting the word out that it's not a good way to tan, it's not a good substitute for the sun? Any legislation on the horizon about tanning beds, which we know are not good?
Well, there's a lot of legislation out there on a state-to-state basis. There are many states now that have outlawed tanning beds in 18-year-olds and younger. and they need to have parental permission. But it is very similar to the story with cigarette use. I mean, we still sell cigarettes, and there's been a warning on the side of the cigarette packets for 50 years. So tanning beds really are not a safe alternative to the sun. There is now a very sharp rise in the number of melanomas in women aged 20 to 30, and it has bypassed breast cancer as the #1 cancer in women aged 20 to 30, and we feel that it's all due to tanning bed use. So that's really what has prompted the individual state legislators to try to pass these laws that prohibit minors from going into the tanning bed. But if you go in even when you're older, that is still going to introduce a risk of skin cancer, and particularly melanomas for individuals. If you visit the American Academy of Dermatology's website, they have a campaign there on it. They have a segment for the public, and they talk about tanning bed use. And one of the things, it's an inside tanning is out campaign where they're trying to encourage young people not to go to tanning beds.
Well, part of it is changing the societal, view of a tan being healthy, when in fact it's just the opposite. I know Nicole Kidman, you have to respect her.
Right.
They have a big problem with skin cancer in Australia, and she's out there looking pale as can be, but she still looks beautiful. But
right.
The rest of us just can't
seem to get around that. Well, Australia is really a leader in skin cancer, and one of the reasons is they have the highest incidence of skin cancer in the world. And so if you go to Australia, the culture there is very different. The children at lunchtime are not allowed out if they don't have a hat and sunglasses and sunscreen on. It's part of their routine. There were also some very large studies that were done in Australia looking at the efficacy of tanning, of sunblock, and they showed, or sunscreen, they showed a 50% decrease in the number of melanomas and a 40% decrease in the number of squamous cell carcinomas over a 10-year period of time with daily sunscreen use. Those are huge numbers. And they were able to prove it because Australia has such a high incidence of skin cancer. And the reason the incidence is so high is because they're so close to the equator. So their risk is much greater than ours to begin with. And it's interesting because in Australia, where you see the vast majority of skin cancers, it's not in the native population. It's actually in all of the northern Europeans who have moved down there, and these are not people who are built to be in the sun. But regardless of what your skin type is, whether you're very fair complected or even darker complected people, anybody can get skin cancer.
Yeah, and I think, well, with young people, that's a typical problem. They just don't want to look that far down the road and worry about such things. And that includes the impact on the skin in the aging department. That it can make a huge difference.
Sure, and if I can't convince my women not to put sunscreen on to prevent skin cancer, I try to talk to them about photoaging and photo damage, because that's also a big component of the sun. You can actually really prevent a lot of the photoaging and photo damage changes that you find in individuals if they start using their sunscreens earlier. And again, that goes back to our UVA discussion. UVA light is the longer wavelength of light, and it penetrates deeper in the skin, so it's what's responsible for a lot of the color changes that you see in the skin. So a lot of women, when they start to notice that their neck is darker and their color isn't even anymore, that's all UVA light. So again, broad spectrum SPF 30, that helps to prevent some of those photoaging and photo damage changes that we see in the skin.
So I guess the moral of this story is read the label.
Read the label.
And use a 30, no tanning beds, and any other key points you want to drive home as we conclude the program?
Also, make sure you add in some clothing. Make sure if you are going to be out for a long day that you wear a hat, and that you try to look for some photoprotective clothing. There's lots of good lines of sports clothing out there now, and this is for people who live active, healthy lives outdoors that are rated with their SPF of 30. And those are a fantastic supplement to your sunscreen. You should still have your sunscreen on underneath the clothing. But if you really, if you're going to be out for a long bike ride or a long run, or if you're going to be out on the boat, the farmers and the fishermen here on the Eastern Shore are very smart about the sun. These gentlemen and ladies have family members who've been out their whole lives, and they've seen older family members develop skin cancer. So they're very smart about it. They will, put covers on the boats, they put covers on the tractors, and we should be doing the same things with our outdoor activity. We can't put a cover over our bicycles or our running gear, but we can wear clothing. And that is, again, what's recommended by the American Academy of Dermatology.
And is that available locally, or of course online, I imagine?
Sure. A lot of good sports stores locally actually carry lines of clothes that actually rate their SPF. So pay attention to that when you go to buy a few new things. The other thing I'd like for people to do is to visit the American Academy of Dermatology's website. It is a great source of patient information. They have a segment for the public, and one part is spot skin cancer, where they walk you through how to do your skin check. And that helps you to be able to recognize things on your own skin, and it's a very accurate way of doing it. And then the other part is called Dermatology A to Z, and they talk about all kinds of common skin problems that people might run into. And it's a great source of information regarding the skin. They don't sell you anything. It is not a product-based website. This is all based on evidence-based medicine. So should be your gold standard for your skin news.
Because you do have to be careful. A lot of these websites, they're giving you information, but a lot of it is towards selling a product.
Correct. And they will do none of that on the website.
Well, we'll post that address at the end of the program then for our viewers. And Liz, thank you so much again for coming on and discussing this very important topic, especially here on the shore where we're all out in the sun and exposed to this kind of thing on a daily basis. So I'm going to wear my sunscreen every day.
And thanks for having me.
And thank you for joining us for this edition of Focus on Health here on PAC 14.